What is tesamorelin? Well, in this video, we'll deconstruct how this FDA-approved peptide mimics growth hormone releasing hormone very similarly because of its unique structure. And I'll show you why some of the other smaller amino acid chain peptides like sermorelin or CJC may not have the same robust properties as tesamorelin does. Now, tesamorelin also goes by the name Agripta. That is the manufacturer who makes this. But from a compounding pharmacy source, tesamorelin can be this unique powerhouse. And I'm going to show you the benefits and what it actually is. And then you can work with your doctor to decide if this is right for you. Now, anything I say, this is not me giving you medical advice or telling you to use tesamorelin. It's me sharing education and some unique insights on how this can work with your body operation system. I'm Regan Archibald. I'm the founder of Ageless Future, and we have a full longevity medical clinic with licensed medical providers who are deeply invested in you feeling, looking, and performing your best. Anytime they write prescriptions for peptides, it's always through a 503A or 503B compounding pharmacy so that your safety is prioritized and your results are prioritized where there's no risk for future downsides, but they do their best at determining this through blood labs. So all you need to do is go to agelessfuture.com, talk to our health ascension specialist, and then we'll figure out the right tests that our providers want for you. Tesamorelin is exciting. It was FDA approved. The studies happened, I believe, 2010 through 2012. They wanted to find out if they could reverse this issue called lipodystrophy in HIV patients. Because what they found is they're accumulating all this visceral fat from the medications that they were on. And this visceral fat was leading to greater levels of inflammation, greater levels of deterioration in their muscle mass. So they were really kind of skinny fat, the skinny fat syndrome. So what they did is they introduced tesamorelin, and they wanted to find the peptide structure that closely mimicked growth hormone. And this 44 amino acid chain, what they found is it was a metabolic enhancement. So this is far larger, and it does seem to have a greater pulse than like CJC. And I know some of you are going to say, I do so much better on CJC or sermorelin. I'm just telling you the structure of the peptide. And I know everyone's biology is unique, but typically you're going to have a greater pulse from tesamorelin because CJC 1295, it's 27 amino acids, sermorelin is 24 amino acids, and this is one, unlike CJC 1295, it is FDA approved, and so that just simply means, it doesn't mean it's a better peptide, but it means it's gone through the clinical trial, so we have more human data on it. So think of this as a precise signaling molecule when it comes to growth hormone. And if you think of your ageless axis, there's three organs that we want to protect. We want to protect your muscle, your heart, and your brain. And by heart, I mean the entire cardiovascular system. So that when you're in your 70s and your 80s and your 90s, you can do all of the 50 benchmarks at the expert level or the fittest level. And I created a program, it's called Fit 50 at age 100. I did it for one of my mentors, Dan Sullivan, who's got a goal to live to be 156. He's 82 now. And he's every quarter I see him and he does better and better. He's getting younger and younger. He's aging in reverse. But one of the things that he looks at is the health of his muscle. And so he asked me to create this Fitness 50 at age 100 benchmarks. And you can access it. Just go to agelessfuture.com or plug Fitness 50 at age 100 in your chat and you'll be able to find these benchmarks. Let me know how you do on it. So what tesamorelin does is it protects your muscle because when you have good growth hormone release, your muscles can recover, your joints can repair themselves, you get better collagen synthesis, so your skin looks better. And I like tesamorelin because you don't get the flushing like you do with like CJC. But one of the unique things about this particular peptide is in the studies, they found that it just demolished that visceral fat. Now, visceral fat is this white fat cell that accumulates around the organs. And just like any kind of disease process, it's contagious. And so it starts recruiting other cells. So you have this accumulation of fat. But what tesamorelin does, they were able to obliterate that visceral fat In some cases, they lost 21, I believe in one of the studies, 21% to 22% of their visceral fat was gone in 6 months. And they found that it had a very low risk profile and that people felt better, not only from a visceral fat perspective, focusing on the body composition, but also from a cognitive perspective. And they actually found that men who are over 60 with mild cognitive decline, they had better executive function, they had an improvement in their verbal composition scores, and they also had better memory retention. So good for the brain. The other thing that happens is tesamorelin, it activates the IGF-1 pathway. Now, IGF-1 LR3 is another great growth hormone releasing peptide. And so it's a lot more robust than the other ones, longer amino acid chains. It's very similar to tesamorelin. But what tesamorelin does in and of itself is it calls growth hormone into act and it says, hey, we need more growth hormone. It knocks on the door. And these peptides are just a gentle nudge. It's just a way of kind of resetting the signaling in your body. And that's what tesamorelin can do. It goes in it and it reminds your pituitary gland, hey, can you please release a little more tesamorelin? Unlike using exogenous growth hormone, which is, here's growth hormone, like it or not, it's coming. But with your pituitary and with the peptides, it's just signaling the release of more growth hormone. And then the beautiful thing about that is when growth hormone gets signaled, now it calls IGF-1 to do the work. IGF-1 is the workhorse. So you can enhance BDNF when you have IGF-1. That means you have more neuroplasticity. You're going to have better repair when it comes to the brain. You'll see better synapses. You'll see better sleep. And I look at tesamorelin as almost like the brain architect or the brain engineer. And when you're getting that deep restorative sleep, that's when you get this nice removal of the protein aggregates, the oxidative stress. You wake up feeling refreshed and feeling like yourself. And so if you think of tesamorelin, think of it as this inflammation reducer because of the visceral fat. And it's not just reversing inflammation in the moment, but once you get rid of that visceral fat, your whole metabolic system starts to transform. And then you can build muscle faster, you clear up the terrain. If you're doing exercises when you're doing the tesamorelin, that's when you'll see the big benefits when it comes to muscle mass. So you'll notice PRs in the gym, you'll notice you can run longer, you'll feel better. It's how you create your entire body operations system. So here's one of the studies. This is a newer one because a lot of the work was done back in, 13 years ago. But this one's called The Efficacy and Safety of Tesamorelin in People with HIV on Integrase Inhibitors, a randomized double-blind placebo-controlled trial. This was done as a multi-center place throughout the United States involving HIV patients with metabolic dysfunction, associated steatoic liver disease, and they were using 2 milligrams daily versus the placebo. And here's what they found. The safety profile was measured over several months. This was double-blinded, placebo-controlled, 61 participants, not a huge study, but they did find that tesamorelin significantly reduced visceral fat, improved metabolic markers in HIV patients on integrase inhibitors, confirming its potency as a 44 amino acid growth hormone releasing hormone analog for targeted body composition redesign with a favorable safety profile. So if you're wondering, what is tesamorelin? Is this right for me? Is this something that can actually help me boost my growth hormone? Well, there's great ways of doing it safely. Make sure that you're working with a licensed clinician who is accessing peptides through 503A or 503B pharmacies. And that's where you can really get the full structure and get the pure version of tesamorelin. And if you'd like to have access to some phenomenal clinicians, go to agelessfuture.com, talk to one of our health ascension specialists, and they'll take great care of you. I'm Regan Archibald. I'll see you in the next video.